A big hello to all of you. There are a lot of myths and superstitions about endocrine, thyroid, hormone problems, diabetes, and obesity in most of the people in society. Even some doctors have a lot of misconceptions. So, this is a humble attempt to clarify the frequently asked questions by patients and public, and I'll try to answer them here in this video. Kindly go through these Q&As and follow them carefully and slowly. Try to understand so that this knowledge should help you, your family, your friends, and society, because knowledge is power. Correct knowledge acts as a bright light in darkness. With this knowledge, you can be part of healthcare by educating and referring appropriate patients and guiding them for correct treatment. Welcome, and you can feel free to contact us for any doubt in future at the following numbers, and also you can follow our information and the services in the below provided website, email address, and also through other YouTube channel links. So here we'll start this journey of endocrine disease and to preserve our health. So here I have compiled mostly frequently asked questions by the patients in my experience and try to clarify them in chronological order. So now coming to the first question, what do we mean by endocrine glands? Endocrine glands are small parts or organs within our entire body. Similar to liver, kidney, lungs, brain, etc., there are about 10 big and several hundreds of small glands, endocrine glands, distributed throughout our body. Some inside our head, some in chest, and some in tummy. Examples of endocrine glands are thyroid gland, parathyroid gland in the neck, pituitary gland in the head, adrenal gland and pancreas in abdomen. Each gland secretes different types of hormones controlling different functions in our body, such as blood circulation, reproduction, fertility, sexual life, memory, brain function, nerve function, bone strength, muscle power, controls sugar level, menstrual cycles in women. It also regulates the pregnancy, excretion in the human body, and also controls the hair growth and maintains the skin moisture and our internal temperature, etc. So now you can understand how vital are the endocrine glands to maintain the homeostasis or the general health and our functions of human body. Just like the external environment, like the climate, sunlight, moisture, atmosphere, the rainfall controls the external atmosphere. Similarly, the endocrine glands, you can say, is synonymous to the internal climate of our body, because it regulates almost all the functions of the body. In summary, if the endocrine glands do not function properly, it can even lead to the death of the patient and also the disease. Now, second question is, what are hormones? So hormones are important chemicals released into our body by these endocrine glands. There are about 50 hormones, each controlling various body functions, just like I enumerated previously. It controls the body temperature, nerve conduction, almost every function of our body. Each hormone has got its own specific function and also several other minor functions. Without this normal levels of these hormones, the patient cannot survive and can lead to a lot of diseases. Even excess of hormone or deficiency of hormone leads to disease. Okay, for example, Excess of insulin can lead to decrease in sugar levels, and deficiency of insulin can lead to diabetes. Now, coming to individual endocrine glands. So, first let us start with the thyroid gland because it's one of the most understudied yet very common disease. Okay, so what is thyroid gland? Thyroid gland is a butterfly shaped gland present in front of our neck. For example, you can see here this is our throat, this is larynx and trachea, also called as windpipe. Now, thyroid gland is a butterfly shaped gland. It is located in front of the neck. It is around 20 grams, usually not visible except in very thin individuals. So this is the thyroid gland. Now, what are the functions or uses of the thyroid gland in our human body? Thyroid gland produces thyroxine hormones and releases them into the blood. The hormone goes everywhere into the body and it percolates into every cell and tissues of our body and maintains most of the functions of our entire body. Rather, it's like a drill master controlling all the functions. In nutshell, one cannot live if thyroid gland is not present or not secreting the thyroxine hormone. It is required for most of all the functions of blood circulation, respiration, body temperature, nerve conduction, reproduction, pregnancy, excretion, and menstrual functions, and all other functions of the body. Now, coming to what is goiter, one of the commonly asked questions. Goiter means swelling of the thyroid gland in the neck. For example, you have seen the normal thyroid gland. If the size of this increases, it is called as goiter. You can see this one, it's a bigger one consisting of many nodules. So this is called as goiter. The goiter can be very lumpy or it can be diffuse swelling. Either way, it looks ugly in the neck, and also it can lead to, if it is very big, it can lead to pressure symptoms like difficulty in eating food or breathing, or it can also lead to dry cough or change in the voice. Now, another question, what are the types of thyroid diseases? People think that there is only one type of thyroid disease and needs only one type of medicine for all. No, it's a huge myth. There are as many as 20 to 30 types of thyroid diseases which changes time to time. Thus, one needs an expert advice by an endocrinologist whenever possible, or at least a physician. To summarize, there are three major types of thyroid diseases. One is hypothyroidism, another is hyperthyroidism, third one is goiter. They can come separately or in combinations. Within goiter, there are 5 types. That is cyst, thyroiditis, colloid nodules, or adenomas, or thyroid cancer. Usually, the 3 types, that is adenomas, colloid nodules, and cancers, need surgical operation, that is thyroidectomy. The type 1 and type 2, that is thyroiditis and cysts, usually need medicines. Rarely, when they grow into big size, then only one needs operation or surgery. Now, another commonly asked questions by the public is, does a thyroid patient gets pregnancy or not? The answer is, it's both yes and no. I'll explain. If the thyroid disease attacks a patient, if they are treated properly with correct dose of medicine, that is thyroxine replacement, pregnancy will definitely occur. It's not at all a problem. It's not that once a thyroid patient will never get pregnancy. No, they will get pregnancy if they are properly evaluated and treated timely. At the other end of the spectrum, if they don't get treated or they neglect the medicine, then they cannot get pregnancy easily. So, whenever possible, the affected patient should consult an endocrinologist and get proper and regular treatment according to the type of the disease. Pregnancy will occur in most of the cases if they follow the doctor's advice. Now, what are thyroid disease symptoms? So, there will be a lot of confusion. So, let me clarify that. There are many types of thyroid diseases. So, symptoms and problems of thyroid patient depends on the type of the disease, age of the patient, family history, duration of the disease, and the severity of the disease. So, there are several factors which are considered. It's not based on just some vague lab report. For example, hypothyroidism is due to low thyroid function. Symptoms of hypothyroidism are usually, not in all cases it is similar, but in 90% of the patients, the symptoms of hypothyroidism are weight gain, muscle cramps, hair loss, dry skin, cold intolerance, loss of appetite, memory loss, menstrual bleeding, excessive menstrual bleeding, constipation, indigestion, gastric dyspepsia, poor growth in children, infertility, loss of interest in sex, and also decreased urination. So these are the several of the symptoms which can occur in combination or in isolation, depends on patient to patient. On the contrary, the symptoms of hyperthyroidism are opposite exactly. That is, increased anxiety, emotional lability, increased appetite, weight loss, irritability, muscle weakness, heat intolerance, palpitations or racing heart. Of course, infertility can occur here also. Headache, diarrhea, high blood pressure, pain in the throat, menstrual problems. So these are the several of the symptoms in hyperthyroidism. That is due to excessive thyroid hormone secretion. Now coming to the third common type, that is goiter. If it is present, it is visible in the neck as a lump or swelling. It can lead to dry cough or hoarseness or change in the voice or pain in the throat, difficulty in breathing or difficulty in swallowing the food, sometimes snoring also. Now, another important question is, should a thyroid patient take iodine salt or rock salt? It may look silly for us, but it's very difficult question for patient. So my answer is, all thyroid patients and normal patients should take iodine salt only. Rock salt is advised by endocrinologist only in certain types of thyroid disease which are very rare. So most of the thyroid patient can or should take iodized salt. Don't worry about rock salt or iodized salt. So the answer is all iodized salt. Now, another very nagging question is, after pregnancy, most of the patients ask, after pregnancy, can we stop thyroid tablets? So what they do is, without any doctor's advice, they stop medicines abruptly. So here the answer is, even after delivery and during breastfeeding, one should not stop the thyroid tablet. They should continue taking the thyroid tablet. Only thing is, the dose may change. Without doctor's advice, no one should stop taking thyroxine tablet even after delivery or cesarean section. It can be stopped only after endocrinologist confirms that the disease is cured after examining the patient and testing is done. Approximately in 50% of the patients we can stop the medicine, and in another 50% it may continue lifelong, or in some patients it can be stopped after 6 months to 1 year after delivery, and it might have to be restarted in the next pregnancy. So it's not a uniform situation for all. It changes from person to person. So in summary, one should always take endocrinologist advice. Now, when and which doctor specialist to consult for these diseases? So, this is another nagging question and very practical one. Any person with any complaints of hypothyroidism, or goiter should consult a physician or a qualified doctor, not quacks or some unqualified person or some pharmacist or other quacks. Preferably, one should consult endocrinologist or endocrine surgeon, as he or she knows better about what tests to be done in which patient and which treatment is to be given. They are more experienced and more knowledgeable, as we see these cases regularly for years together. It's for your own benefit. Now, another important bit of advice I want to give, a very important one, is what about the advice of quacks or false promises or wrong treatments or homemade granny remedies? Are they correct? So many patients get confused and get misled by the information in the internet, Google, and by the quacks or the society or some of their relatives. So everyone acts like a doctor and keeps on giving muftka advice, that is a free advice to the patients. They also give false assurances in the form of some form of special diet or cardio diet or coconut oil diet or powders or pills, by claiming that the disease will be permanently cured, that is the thyroid disease will be permanently cured, and even big goiters disappear without any operation. Please remember, never fall into the trap of this wrong info. They even wrongly say, some quacks say, that big goiters or cancers get cured by special diet or pills. Remember, please follow science, knowledge, and experience. Don't fall prey to this false assurance or shortcuts. There are no shortcuts for success, as all of you know. You have to follow science and take expert opinion of endocrinologist doctor. No one can cure these endocrine diseases permanently with a magic pill or a magical treatment. The cure of the disease depends on type of the disease, its nature of the disease, duration of the disease, the severity, and also the genetics of the type of thyroid disease. Only the best solution of these diseases is to get regular consultation, regular tests, treatment, medicines, diet, and exercise, appropriate one, as prescribed by expert specialist endocrinologists. Don't fall to any trap. If surgery is compulsory for a goiter, it has to be done, as it can become cancer in due course of time. Not all thyroid patients need surgery. In around 5% of the patients, surgery may be needed. I will come to the details of when and how to be done subsequently. Many quacks and half-educated people try to give self-proclaimed magic medicines and treatment with false promise of cure. Please beware about these false promises. Follow science, please. That's my humble bit of advice. Now, another important question is, what tests have to be done for endocrine and thyroid disease? The common mistakes done by many patients is either on their own self or based on the advice of a quack. They get blood testing done by some lab by themselves, and also sometimes they send their blood samples to a branded lab with reports coming after 3 days to 1 week from bigger cities. There are I'll clarify that. There are several tests like serum T3, serum T4, serum TSH, that is thyroid stimulating hormone, anti-TPO antibody, thyroglobulin, and many other side tests to know the side effects of this thyroid disease, like renal function test, lipid profile, hemogram, calcium, bone profile, liver function test, etc. No one should get tests directly done by themselves without a doctor's advice. Proper way of testing is to be get done only as and when advised by endocrinology doctor. That too only in specified lab by doctor. That too only interpreted by the referring doctor. The reason is, most some of the labs give wrong reports. Tests have to be done on fresh blood sample with proper standards and controls. The result has to be correlated with patient's health condition, type of disease and age of the patient. The lab tests cannot be interpreted on their own. For example, some patients send their reports through WhatsApp and they ask what dose to be taken. So we cannot tell like that. We have to evaluate the patient based on the patient's examination evaluation. Then only the tests have to be interpreted and the appropriate treatment can be advised. It's not that based on, it's not mathematics. So remember, the medical treatment and health is not mathematics. In mathematics, 1 plus 1 is 2. But in biology or medicine or health, 1 plus 1 is not 2. It can be anything from 0 to infinity because it is dynamic and it depends on several factors and varies from patient to patient. So subsequently, in case of goiter, we may advise tests like ultrasound scan or needle FNAC test, CD scan. So based on that, surgery or medicines are decided. So finally, follow science, follow an expert endocrinology doctor. Now, how long the treatment has to be taken? How long is the follow-up schedule? Similar to hypertension, asthma, diabetes, thyroid disease is also a lifelong or long-term disease. One should take medicines for lifetime with regular 3 to 6 months interval checkup and follow-up. Only in 50% of cases it can be cured and medicine stopped. That too in some types. But when to stop medicine has to be decided by the endocrinology doctor, not by the self. No one should stop treatment suddenly without doctor's advice because it can be dangerous and also life-threatening. Now coming to another important question. When do we need surgery, that is operative removal of the thyroid gland or the goiter? So thyroid surgery, as I told previously, it is done in approximately 5 out of 100 patients for some types like adenoma or cancer or nodules or big goiters. Surgery is needed even for goiters with pressure symptoms. For example, you can see here there is big goiter. This was removed here. So this was causing pressure symptoms like dry cough and change in voice. And some types, as you can see here, this thyroid cancer, one has to remove this, otherwise it can spread in the whole body and can be life-threatening. So what are the types of surgical operations for thyroid and how it is done? So there are broadly 3 types of operations. So one is open thyroidectomy, second is laser or harmonic thyroidectomy, third one is laparoscopic thyroidectomy. The type of operation again is decided on several factors based on the size of the goiter, type of disease, age of the patient, need and desire of the patient, and of course the financial aspect, and also whether it is cancer or not. The type of surgery is decided by expert endocrinology doctor or endocrine surgeon after exact diagnosis and after discussing with the patient and their relatives. The surgery is mostly done under general anesthesia and the patient will be unconscious without pain during the entire surgical procedure. Now, how the patient is worked up before surgery? So, a lot of people have a lot of doubts on this. So, let me clarify. Any patient with thyroid symptoms or neck swelling or goiter must consult endocrinology doctor and get appropriate testing done, and only after deciding the exact type one should go for surgery. So this is very practical question. Now what I'm going to answer is, the question is, are there any complications because of surgery? So many people are afraid of so many problems. Naturally, no one undergoes surgery with happiness or with jubilation. So let me give some courage here by clarifying. So in the hands of experienced super specialist endocrine surgeon, nothing will happen. It is almost 100% safe. Very minor problems can occur like temporary slowing of voice for 1 to 2 months, low calcium levels occurs in about 1 to 2% of the patient with vitamin D deficiency, and only that too in complicated advanced thyroid cancers in very old patients with other risk factors like heart, kidney or liver diseases. Then only the operation is risky. Otherwise it is a very safe operation. There is no need to fear. In the hands of experienced surgeon, nothing will happen. So, what about, is there any special care to be taken after operation? If it is case of thyroid cancer, I advise them radiation treatment with radioiodine after surgery after 3 to 6 months. If the thyroid gland is removed totally, the patient needs to take lifelong thyroxine tablet with regular testing at 3 to 6 months intervals under doctor's supervision, not on own or quack advice. The reason for taking expert advice is dose may vary from time to time. More days here, remember why one should not self medicate. The reason is if the dose is more, it will cause heart disease or bone weakness. If the dose is taken less quantities, it will lead to kidney problems, liver problems, and muscle cramps. Correct dose is decided by an experienced doctor, not on your own. Now, another important question is why do we need lifelong or long term follow up in consultation? Remember, any thyroid patient should consult at 3 to 6 months intervals for lifetime because with increasing age, the dose needs may be changing. For example, in case of goiter and cancer, it may occur again. So, we need to have follow up to check for any recurrence. At the same time, heart disease, bone, kidney side effects may occur at follow up. All will be taken care by us. The reason is it's not just about one single TSH test. So we need to check the overall health condition at each follow up. So it is for your own good. Okay, it's just like say you are getting your car or vehicle checked for servicing. So just like we do servicing for our vehicles, own vehicles, we need to do servicing for our own body. Whoever has any thyroid disease or any other hormonal or endocrine disease, we need to get periodical checkup and servicing and get it certified by a doctor like endocrinologist. It's for your own good. Now, let us go away from thyroid to other diseases. So, one important disease which I am telling now is PCOD, that is polycystic ovarian disease. So most of the women in reproductive age group between 20 to 50 may have these PCOD, which is characterized by specific hormone disturbance due to increase in male hormones and decrease in female hormones, along with small multiple cysts in the ovaries in few patients. This disease usually occurs in reproductive age. It is a very nagging disease with many complications like hypertension, diabetes, weight gain, abnormal hair growth at abnormal places, unwanted hair in women, decreased menstruation, infertility, high cholesterol, joint problems, etc. It's a very difficult disease to treat and is commonly associated with high calorie diet and high stress in the life. So one needs to have lifestyle change along with certain medications with appropriate testing by the endocrinology doctor. How do you manage and treat PCOD? So here a PCOD patient has to urgently consult an endocrinologist. An endocrinologist will examine the patient thoroughly, conduct specific hormone tests and scan. Based on the type of PCOD, there are many types of it. Based on the type, severity and also based on the complaints, we advise certain medicines, specific low calorie diet, exercises and sometimes rarely laparoscopic operation for the ovarian cysts. If you strictly follow our advice regularly, it can be cured in most of the cases. It takes approximately 2 to 3 years for proper results and cure. Remember, do not hurry for the results. and fall into shortcuts by quacks and internet remedies. Trust science and time. These are the golden words. Now coming to another important disease, that is what is parathyroid disease and what are its problems. Is it dangerous and how to get treated? So here close to the thyroid, there are four small parathyroid glands which are peanut sized. So these glands are very important glands, small endocrine glands in our neck. Similar to thyroid gland, there are four small peanut sized parathyroid glands in the neck. They release PTH, that is parathyroid hormone, into the blood, which helps in maintaining normal levels of calcium in the bones, blood and muscles. So calcium is one of the most important minerals in our body. Parathyroid disease usually occurs in women between 40 to 60 years, but it can occur in any age group and even in men also. It occurs in 1 out of 1,000 people. In parathyroid disease, the symptoms are multiple bone pains, bone fractures, repeated kidney stones, urinary infections, gas problems, muscle weakness, mental disturbance, depression can occur. In parathyroid disease, we need appropriate hormone tests and scanning. Surgery is the only treatment for parathyroid disease, wherein I remove the diseased parathyroid gland, which can be in the form of tumor, adenoma or cancer in the neck. The only cure is surgery. There is no medical cure for this disease. If it is not treated, parathyroid disease can be very dangerous and it can be life-threatening. Surgery is again either done in open method or laser method or laparoscopy technique. Now, so what is the correct treatment for thyroid cancer goiter, and is surgery compulsory or not? This is another important question. I'll clarify. Though compared to all other cancers in our body, thyroid cancer is less dangerous, but it absolutely needs surgical treatment in 100% of the case for cure. Without surgery, goiter cancer will grow in size and can spread into all parts of the body and can affect the life of the patient. But surgery is best done by experienced endocrine surgeon, as best results occur in their hands compared to other specialty doctors or surgeons. There are many types of thyroid cancer, around 10 types, and there are 4 stages. We need to work up, investigate and give exact treatment to the patient based on the type of stage and grade of the thyroid cancer. After that, we plan radiation treatment depending on biopsy report. Now coming to another important gland, that is adrenal gland. So here you can see these two are kidneys in our upper part of the abdomen or tummy. Above kidneys there are small less than 1 centimeter glands called adrenal glands. So this is adrenal tumor. Compared to other endocrine diseases, adrenal glands or tumors are very rare. Adrenal glands, they secrete multiple hormones. For example, cortisol, aldosterone, sex steroids, catecholamines, which help in maintaining the normal blood pressure, electrolytes, sodium level, and also it dictates the stress response and our immunity in human body. Without these adrenal hormones, a person cannot live. Even with excess of these hormones, multiple problems can occur in adrenal disease. For example, in adrenal gland tumor disease, symptoms can range from high blood pressure, infertility, weight gain, bone pains, pain abdomen, muscle weakness, diabetes, and infections, etc. For adrenal disease, one should show to endocrinology doctor to get appropriate workup, proper tests, and also proper treatment. In case of adrenal tumors, surgical operation in the form of adrenalectomy may be needed. It can be again done in three methods, that is open adrenalectomy, laser or laparoscopic adrenalectomy. Now, coming to another important endocrine gland in our brain, that is pituitary gland. What are the problems of pituitary gland and how to get treated? See, compared to other endocrine diseases, again pituitary gland disease or tumors are rare. Pituitary gland is located in the brain in between the eyes. Here inside, it's a small peanut sized gland. It secretes multiple hormones like LH luteinizing hormone, FSH follicular stimulating hormone, TSH that is thyroid stimulating hormone, prolactin growth hormone, ACTH that is adrenocorticotropic hormone, etc., which helps in maintaining the growth, muscle and bone power, electrolytes, normal blood pressure and also stress response. Without these hormones, again the person cannot survive. Even with the excess of these hormones, multiple problems can occur in pituitary disease. The symptoms again is very varied, such as high blood pressure or infertility, weight gain, bone pains, muscle pain or diabetes or repeated infections. For pituitary disease, one should show again to endocrinology doctor to get worked up, properly tested, investigated and treated. In case of pituitary tumors, surgical operation in the form of hypophysectomy may be needed, but most of the cases can be treated by medical treatment with medicines or drugs. Rarely surgery is needed. Now, coming to one of the most common disease which all of you know, in fact, one can say that is diabetes. So, diabetes, India has become diabetic capital of the world. And it has become very common not only in affluent countries and also in underdeveloped and developing countries. See, amongst all endocrine diseases, the diabetes is the commonest and most frequent problem in the society. It occurs in 5 to 20% of the population. One needs to get correct treatment from endocrinologist to control the sugars and also not only the sugar control, for the prevention of the complications, one needs regular testing and checkup. If proper treatment is not taken, it's a life risk disease and it can kill the patient in several forms because it affects the kidneys, liver, eyes and bones. Regular exercises, medicines and checkup, diet